You may not know his name, but you definitely know his music. It's very sad news that Steve Harwell, the singer from the band Smashmouth, passed away from liver disease as a result of a long-standing battle with alcohol use disorder. So this is something that hits really close to home for me because as part of my job as a hospital medicine physician, I treat patients with liver disease all the time. In fact, probably not a week goes by in the hospital when I don't have at least one or two patients with some sort of complication from liver disease. So I did want to make this video to talk about some common issues that can happen when your liver is not working properly. I'll keep this video focused on alcohol-related liver disease. So here's what happens. When you drink alcohol, your liver is responsible for breaking it down and metabolizing it so the body can get rid of it. But with long-standing heavy alcohol use, what happens is you can develop hepatic steatosis. This is a fatty liver where the liver can become very enlarged. Then over time, after that, you can develop fibrosis and eventually cirrhosis. And then this is where the liver stops performing its functions optimally. So for example, with cirrhosis, you get scarring in the liver. This leads to a buildup of pressure in the abdomen. So normally the blood flow in the body, your heart pumps blood, it pumps it around the whole body. And then before the blood returns back to the heart, it goes through the liver. But when, in the case of cirrhosis, when the liver is scarred, there's a lot of what we call portal hypertension or increased pressure, which makes it harder for the blood to move through. This builds up pressure further, which can cause fluid to accumulate in the belly. So this is a reason why people with end-stage liver disease can look like they're 9 months pregnant, or I'd make the argument that they look like they're 14 or 15 months pregnant, if that were even a thing. The belly can just get huge. And these people will oftentimes need to have all this fluid drained from the belly in a procedure called a paracentesis. So this is where the skin and soft tissue are numbed, and then a doctor puts in a needle with a catheter, a little thin rubber tube over the needle inside the belly, to then attaches that to a vacuum tube to drain fluid from the abdomen. Sometimes these people need to have this procedure done and even multiple times a week. Because the fluid can reaccumulate. And just to give you an idea of how much fluid can be in there, sometimes we take out 10 liters or even more fluid from the abdomen during this procedure. This, of course, has its own issues. I mean, that's pretty stressful for the body to undergo those fluid shifts. So you have to give medications like IV albumin to just help with the hemodynamics so you don't develop low blood pressure after this procedure. Another issue that can arise still from the same process, just scarring in the liver leading to increased pressures, is esophageal varices. So this is where the pressure causes a buildup in the veins in the esophagus. These veins get very dilated. We call them varices, and then if they bleed, it can be a huge problem. It can be a nightmare because when these varices bleed, you can bleed to death in a matter of, minutes. It can be acutely life-threatening. I'll tell you one story that I'll never forget. I was a resident doctor working in the emergency department, and we got a call that there was somebody who had started vomiting blood. And so that's not a good sign, but I'll tell you what's really not a good sign. When this patient was wheeled into the emergency department, paramedics were already performing chest compressions on him. So he had lost his pulse, he had gone into cardiac arrest. So as part of the Code Blue team, I ran to his bedside and I'm trying to get in a central line. So that's a very large IV that you place in emergent situations like this. I was trying to get it in the femoral vein. Meanwhile, they're still doing chest compressions, and I'll tell you, blood wasn't oozing out of his mouth. It was flowing. It looked like a waterfall of ongoing blood that was just going out of his mouth onto the chest, onto the bed. And as they're doing chest compressions, just more blood is just coming out. And they're ordering blood transfusions, but it does not look good. And meanwhile, I'm trying to get this line in. I think I have the position just right, but I can't get any blood flow back. When I use a syringe to try to get blood flow back out of the central line, nothing really comes back. And finally, now we're like 20 minutes into the Code Blue. The intensivist I'm working with looks at me and says, "Hey, I think I know why you're not getting any blood flow back. It's not because the line doesn't work. It's because the man has no blood. He is completely exsanguinated right in front of us." And, you know, that might be an exaggeration, but it might not be, to be honest with you, because with all the blood loss that you can get from these ruptured esophageal varices, that's what he had. You can bleed to death very quickly. So unfortunately, not too long after that, we called an end to the code blue, and he passed away from blood loss. So I wanted to tell that story. It's a vivid one. I probably should have given a trigger warning for some graphic details before going into that, but that's one that I'll never forget. That really impressed upon me how fast and how violent these esophageal variceal bleeds can be. All right, so we talked about portal hypertension leading to fluid in the abdomen, which we call ascites, by the way, and then also the esophageal varices. So liver issues from alcohol use, chronic alcohol use, don't stop there. You can also get confusion. So the liver helps the body get rid of ammonia. And when it is not working properly, ammonia can build up in the body, leading to confusion. We call this hepatic encephalopathy. Treatment for this generally entails taking a laxative called lactulose, which helps to bind the ammonia and helps the body get rid of it. Finally, the last thing I want to mention is that as liver disease progresses, when the liver really starts to fail, it tends to take down other organs with it. And one of the organs that can go is or are the kidneys. So we call this hepatorenal syndrome. And so this is typically a very bad situation because with kidney failure, the way you treat it is you treat the underlying problem. If the kidneys are failing from an infection, you give antibiotics, you get rid of the infection, kidneys get better. If the kidneys are failing from blood loss, like a gunshot wound, somebody's bleeding out, they're in hemorrhagic shock, you give blood transfusions. You fix the underlying problem. If the kidneys are failing from dehydration, you give IV fluids. But if the kidneys are failing from a failing liver, what do, right? You got to fix the liver. And at this stage, oftentimes the only fix is a new liver. You've got to go for a liver transplant. And this is not a walk in the park, okay? First of all, it's a huge surgery that only a few tertiary medical centers can do. Secondly, you have to get a liver. And these livers are not easy to come by. You have to get on the list. And the one problem is oftentimes the liver fails from alcohol use. Well, if you're still drinking alcohol, you don't qualify for a liver. So that's often a barrier for a lot of people who really would need a liver transplant. And the rationale is with these liver transplants being so hard to come by, you don't want to give a new liver to somebody who's still drinking, and then that individual might just end up ruining the transplanted liver also. All right, so that was maybe not my most organized video of all time, but that's a few of the issues that I routinely encounter with regard to alcohol-related liver disease in the hospital. And so once again, sad to hear the news about Steve Harwell. Maybe I was never like the hugest Smashmouth fan, like I never had a poster of him in my room, but man, I know every word to that song All-Star. And I think chances are, if you grew up in the 90s, you probably do too. So our thoughts are with Steve Harwell's family and friends and the millions of people whose days were made a little bit brighter every time All-Star came on the radio. Thanks for checking out this video, and I'll see you guys next time.